The state of our health, something we strive to improve and maintain, but sometimes inadvertently destroy. Universally, it's vitally important. The Germans have a universal word for it. Gesundheit.
Coming up, what men need to know about osteoporosis. While most males comprehend that the degenerative disease is more prevalent in women, they're often shocked to discover that it can prove far more fatal for them. Health checks by video. Concerned parents are asking to have tapes sent from overseas adoption agencies in order for their trusted family GPs to perform long-distance checkups. We review the latest research in the ongoing fight to stop the developed world's biggest killer, heart disease. Among the advancements, a new drug-coated stent to keep arteries open and a combination defibrillator and pacemaker in one. And the small flat leaves the citizens of northern Nicaragua call fresco de tamarindo. Picked for their medicinal value, the leaves are a popular remedy for a variety of disorders, from inflammation to fevers and digestive problems. But first, canker sores. They can make eating and drinking simply excruciating. The small white wounds inside the mouth were once thought to be caused by a virus. But now it's believed that canker sores are actually the result of either stress, dental treatments, or smoking. The Food and Drug Administration recently approved a liquid bio-bandage to help ease the pain while the sore heals. It's been used in operating rooms and hospitals for years, but is now available for over-the-counter use. The Soothe and Seal liquid protectant uses a chemical called liquid cyanoacrylate. Once used as an alternative to stitches in hospitals, it seals off nerve endings in canker sores for 6 hours. Canker sores should be checked if they don't heal within 2 weeks. While they're not contagious, deep ulcers can easily develop, so it's always best to play it safe. Dentist Brendan Huang is about to perform surgery on this woman with no anesthetic. This special tool will make it completely painless. Air abrasion is used to treat cavities instead of the more traditional drills. By controlling the speed and intensity of the air, only the decayed tooth is removed, not touching healthy areas of nerve endings and therefore no pain. In contrast, if a drill is used, an anesthetic is required. Patients terrified of the needle and drill needn't worry about visiting the dentist any longer. Air abrasion is also much quicker than drilling. It takes 5 minutes to fill one cavity, compared with 40 minutes using a drill, and that always brings a smile. But air abrasion can't get to the root of all dental problems. If cavities are too deep or a metal filling needs replacing, then it's back to the trusty old needle and drill. Patricia Caruso was one of the millions of people who dreaded going to the dentist, but that was before she found an alternative to the pain and anguish. She now visits holistic dentist Dr. Dara Neumann-Kessler, who believes the body has an innate ability to heal itself. Dr. Kessler talks to her patients about how diet, lifestyle and emotions may be affecting their mouths. The emphasis is on natural remedies. For example, metal in the mouth may be the cause of some skin rashes or vision problems. Often, holistic dentists will replace mercury or gold fillings with biocompatible materials. Caruso had her fillings replaced and has changed her dental hygiene routine, all the way down to natural toothpaste. She now understands that the food she puts in her mouth not only affects her dental health, but her general health as well. In many a case, patients have had to treat underlying problems in order to address some painful dental symptoms. And dentist Yu Xian has set a record, building an 8-foot tower of human decaying teeth. The tower earned him a certificate from the Chinese government honoring great achievements and secured him a place in the Shanghai Guinness Book of Records. While he likes having his achievement recorded for history, he'd rather people keep their teeth longer. His dental work of art took 6 months and 28,000 teeth. He's been working on teeth for 30 years, but now he's seeing patients who've gone decades without any dental care at all. Critics say Dr. Yu may have been a little too eager to finish the tower, pulling teeth that could have been saved. However, he disputes their claim, saying the smaller the tower, the happier a dentist he'd be. Though osteoporosis is more prevalent in women, it strikes men too. Just ask 89-year-old Bernard Henkin. His 82-year-old wife never got the disease, so he was shocked when he learned he had lost 5 inches in height. Research has shown men lose bone steadily over their lifetime, whereas women tend to experience a more dramatic drop with the onset of menopause. According to Dr. Douglas Keel, an osteoporosis expert, the disease can prove even more fatal for men, as up to 25% of them die within the first year of a hip fracture. Dietary mineral expert at Tufts University in Boston, Dr. Richard Wood, believes that if men were more aware, they might prevent osteoporosis in the first place. That means drinking milk or getting enough calcium and vitamin D from other sources, both to build bones to their genetic potential in childhood and to replace what's lost each day in adulthood. Bernard now takes calcium and vitamin supplements along with Fosamax, the only medication approved for the treatment of osteoporosis in men. However, he wishes he knew about the disease long ago. So far, the treatment's working. His bones and height have stabilized. Now he and his wife are looking forward to their 60th wedding anniversary. And there's good news for women too, who hate having to take osteoporosis medication every day on an empty stomach, followed by unpleasant side effects. According to research just published in the New England Journal of Medicine, an annual injection of a cancer drug can prevent the bone-thinning disease just as well as the daily pills. Researchers tested 351 postmenopausal women around the world with 5 different treatment schedules. Some got the standard once-a-day pills to fight osteoporosis. Others received 5-minute intravenous infusions of a Novartis cancer drug called zoledronic acid. The results showed similar improvements in bone density for the women on pills and the women receiving injections, including the once-a-year injection. However, there were far fewer side effects and complications experienced by those in the latter group. The point of treating women for osteoporosis is to protect them from humped backs and easily broken bones. The researchers won't know for another 5 years if the new treatment actually prevents fractures, but a much larger study is being planned to find out. In China, this is often the fate of children whose parents are serving time in jail. Shunned by society and left to fend for themselves, many end up on the streets begging to survive. The social stigma of crime means relatives are often unwilling to care for these children, or are abusive if they do. But one female prison officer decided to help. Defying strong opposition, Zhang Shuxin set up special villages around the country for the abandoned children of prisoners. The villages survive on donations and aim to provide a safe, caring home, while psychological support is available for children who've been traumatized by their experiences. Aged 6 to 14, the children get regular meals and an education. They also have time to do things like picking fruit in nearby fields. Their lives have changed dramatically since coming to the village. There are 3 villages so far, and plans to open others throughout China to give more kids like these a safe haven and a place to call home. Terry and Laura look alike. They could be biological mother and daughter, but the 11.5-month-old is adopted. Marta was her name at the orphanage in Kazakhstan, where this video of her at 2 months old was taken. Marta had many serious health concerns, ranging from rickets to hypertension, so Terry and her husband Michael sought the help of Dr. Kate Cronin of the DuPont Hospital in Delaware. Doctors use the videotape to check for any physiological and behavioral problems, but most countries don't provide videos, so decisions must be based on medical records and still photographs. And better yet, a discussion with the medical staff at the orphanage. Dr. Cronin's phone call revealed that many of Laura's health problems were misdiagnosed, but she still requested an updated video and advised Terry and Michael to take their time. The baby's eye contact was strong and she was holding her head up, but at 5 months old, she still wasn't babbling. Nevertheless, Terry and Michael travelled to Kazakhstan for their daughter. With her new parents' love and care, Laura was rolling over within 3 days and sitting up on her own within a month and a half. Since last seeing Laura via video, Dr. Cronin has witnessed a remarkable turnaround. She's crawling, standing, babbling, and doing all the other things a typical 11-month-old would do. Today, little Nora's a healthy handful, bringing her parents great joy. In sadder news, the continuing saga of sexual abuse carried out by Catholic priests against young boys is becoming the largest sex scandal in church history. The frenzy began when Boston priest Father John Geoghegan was sentenced to 10 years on sexual abuse charges for molesting more than 130 children over 30 years. Psychiatrist Dr. Norman Rosenthal believes that damage done from sexual abuse can be lifelong because it involves violating boundaries of trust. Whether the abuse is carried out by a priest or family member, the damage is intensified because the abuse is hidden. For that reason, Rosenthal believes that it can be healthy for sexually abused people to come forward, even as adults, to confront their abusers, just as Mark Serrano did, charging he was molested by a priest beginning at age 9. To Serrano, the priest and church were one. Rosenthal outlines the physiological changes in the brain that occur after abuse in his book, The Emotional Revolution. But he's quick to point out that with the right help, it's never too late to overcome even the most painful past. In related news, the UN estimates that last year alone, almost 13 million people were on the move, among them 700,000 children being trafficked for sex. The Philippines' port of Manila sees up to 500,000 poverty-stricken women and children every year. This young woman was one of the thousands of teenagers who were drugged and sold for sex. But it's not just in Asia. In Nicaragua, this young girl is being prepared for a night's work. In Europe, Albanian children are trafficked into Greece, many sold by their parents. And in Sierra Leone, thousands of children have been abducted and raped by militia. The UN is fighting back with education like this school in India, which tries to provide schooling to the very young, hopefully to give them a chance later in life. But it's a lucrative trade, and the UN is sometimes forced to even fight the battle with governments, all too keen to turn a blind eye to this profitable form of abuse. It often has no symptoms and there's no known cure, but this genetic heart condition can claim a young life in an instant. 15-year-old Colin Dolder has had hypertrophic cardiomyopathy, or HCM, for 3 years. It's a disease that causes the heart's main chamber to enlarge, making it vulnerable to life-threatening rhythm abnormalities. Dr. Barry Marin of the Minneapolis Heart Institute is trying to raise awareness of the disease that affects 1 in 500 people. He also discovered that hypertrophic cardiomyopathy is the leading cause of sudden death among young people and even among trained athletes. Only an echocardiogram can give complete pictures of the heart, showing problems that would normally be missed. While some HCM patients live normal lifespans without symptoms, the disorder can cause death or disability, especially among those who put extra strain on their hearts. Colin's mum, Connie, was shocked that not only was her son sick, but he had a relatively common disease that few people had ever heard of. In some cases, a heart transplant is the only option for HCM patients. Others can be treated with medication or implantable devices. When a heart stops, a race against time begins. Paramedics struggle to keep the victim alive long enough to get to a hospital. But with a survival rate of 5% or less, the odds are stacked massively against them. A recently published study shows that a drug called amiodarone can double the patient's chances of getting to the hospital alive. When a person goes into cardiac arrest, the first response is cardiopulmonary resuscitation, then defibrillation. But if by the third electric shock the heart hasn't returned to a regular beat, the standard procedure is to inject the drug lidocaine. While amiodarone has more chance of getting a patient to hospital alive than lidocaine, it's harder to administer, with the paramedics having to prepare an IV on site. And even if a patient does make it to the emergency room, amiodarone doesn't raise their chances of getting out alive. Another study in the New England Journal of Medicine has shown that ice packs used to chill the bodies of cardiac arrest victims will dramatically reduce neurological damage from stroke. Scientists are advising that ambulances should carry ice packs to be placed on a patient's body immediately. Applied in time, the cooling can improve their chances of surviving with little or no neurological damage. The findings from Australian and European researchers in 2 separate studies offer an inexpensive new tool to help the millions of people who suffer cardiac arrest worldwide. While CPR or a defibrillator can restart the heart, a series of brain-damaging chemical reactions may have already started if too much time had elapsed. Doctors at Duke University Hospital in North Carolina have already noted many positive effects of the cooling technique. If the heart stops beating for more than 5 minutes, brain damage or death is very likely. But lowering the body temperature to 92 degrees Fahrenheit, 6 degrees below normal, is considered the optimum temperature. Of the 1.1 million American heart attack victims each year, only about 20% get to the hospital in time to benefit from the latest clot-busting medication. Non-invasive prevention implantable. These were the buzzwords at a recent meeting of the top minds in cardiac care. Among the advancements in the research into the world's biggest killer, heart disease, is a new drug-coated stent that's proven 100% effective. Surgeons can now combine balloon angioplasty with stainless steel stents to prop arteries open. But the body builds scar tissue around the stents, causing it to reclog, a process called restenosis. The new stents stop this from occurring. The drug-coated stent is not approved by the FDA yet. Researchers are still working on ensuring that the drug coating is not rejected by the body. Another bit of high-tech help for the heart is a combination defibrillator and pacemaker in one. Research on the FDA-approved InSync shows positive results. These patients have faulty wiring in their hearts that causes abnormal rhythm. The condition is usually fatal within 5 years of diagnosis. The InSync not only regulates the heart's rhythm, it also shocks the heart if it beats irregularly. Studies showed that those with it survived longer and had a better quality of life. Japan's snow monkeys have known for ages the joys of a hot outdoor bath in the middle of a cold winter's day. But now people from across the globe are discovering the same pleasure in Iceland. The Blue Lagoon is an outdoor spa created from the runoff of a geothermal power plant. Never mind that the temperature outside is below freezing, the warm waters in the lagoon average a comfortable 100 degrees Fahrenheit. But these waters offer more than a pleasant excursion on a cold day. The lagoon's mineral content is known to cure common skin ailments like eczema and psoriasis. According to scientists, the unique ecosystem of blue-green algae and silica mud coupled with the location's unpolluted surroundings form the treatment's foundation. The medicinal attributes of the water were discovered by chance. Today, the lagoon runs a skin therapy outpatient clinic. Treatment for psoriasis takes about 4 weeks. The cost for Icelanders is covered under the country's national health insurance. The price for foreigners depends on the length of their treatment. A daily visit, excluding special treatments, costs about $80 US. However, most of the people who arrive at this oasis don't come for treatments, but rather to be treated to an afternoon of relaxation. There's nothing like it. That relaxed feeling is shared by many. Last year, 315,000 people visited the lagoon, more than the entire population of Iceland. In the South Pacific, where it's grown, kava is considered the drink of the gods. The root can help people relax, de-stress, and ease pain. James Adelson has used the kava that he sells in his New York City store to deal with anxiety. But kava is coming under increasing scrutiny by regulators in the Western world, where researchers have linked the herbal remedy to over 24 cases of hepatotoxicity or sick liver condition. Several people have needed liver transplants, and one person died after using it. Dr. Roberta Lee, the medical director at the Center for Health and Healing at Beth Israel Medical Center in New York, has studied kava extensively. She believes the problems arise when it's processed into capsule or liquid form. Already Australia, the United States, Canada and some European countries are warning people about kava. Kava products have been withdrawn from many store shelves in the UK. The Swiss have banned them, and the German government is considering making them prescription only. According to Dr. Lee, this action may be slightly hasty, considering the side effects of kava are as dangerous as those from prescription anti-anxiety drugs.